Good morning, everybody. Welcome to class today. Today we're going to talk about flail segments. So before we go into that, I want to ask you something. What are the three things that you must be aware of when you come up to a trauma patient? You're scanning the patient. You are looking for three major injuries that you're going to immediately intervene with. Well, what are those? Spoiler alert, it's going to be flail segment. The other two, second chest wound, profuse bleeding. If you see any of those three things, you're going to immediately stop everything that you're doing, immediately go in and start treating them. Right now, we're going to talk about flail segment. So what is a flail segment? When we talk about that, all right? So we're dealing with the chest cavity. We're dealing with the ribs. That is two or more ribs broken in two or more places. That is exactly how you would describe a flail segment. Now, are we going to have an x-ray machine? Of course, we're not going to have an x-ray machine where we can immediately take a picture and be like, oh, that's a flail segment, or, oh, there's only one rib broken in one place. No, it's going to be two or more ribs broken in two or more places, but there's a way that we tell. So you come up on this patient and you see that they are breathing. With that section of ribs that is broken, you're going to notice this, right? So the chest is going to be unequal. It's going to be going like this. What is the name of that? Anybody know? Good answer. Over there. Good answer. Paradoxal movement. That's what that is. Paradoxal movement. When you see that, at that point, you're going to know that this patient has had some kind of significant injury to the chest. You see that paradoxal movement. And at that point, what you are immediately going to do is intervene with what? What is the treatment for flail segment? Good answer. Internal splinting. Whoever said that. Internal splinting. We no longer put bulky bandages or wraps on the chest. At this point, all we're going to do is internal splinting. How do we do that? BVM. Let's show you. All right, so you come up, this patient's got a section of his chest, obviously injured. You see the paradoxal movement. We're going to lay the patient down. Get our BVM out. We're going to connect this bad boy to our O2 tank immediately. Turn it on to 15 liters. Get you a good face mask seal. And you're going to begin ventilation. So how do you ventilate with the patient with flail segment? It's real easy. This patient's going to be breathing already because obviously that's how you could tell. I mean, you could feel for crepitus, but you're not going to see that paradoxal movement if they're not breathing. So if they are breathing, which is the key, now you're going to ventilate whenever they breathe in. So you see them breathe in, you're going to help that ventilation and then let off. You are just going to assist ventilations at this point. So that's how we treat flail segment. It's pretty straightforward, but just know this. You come up on a patient, you see that. Immediate intervention is key. Back valve ventilation is the way. 15 liters of oxygen. I hope this helps you. Hey, see you guys in class.